What is something about neurophysiology that surprises people when you explain what you do?
When the brain sends a signal to the muscles, it's all electrical discharges. We pick it up on the monitor, and from the sound and from the way the wave patterns behave, we can say whether the muscle is damaged or not.
What is something about the brain or nervous system that still amazes you?
There is a lot of things about neurology and brain we still haven't been able to figure out. So we still haven't quite cracked the code yet. Yeah, there's still new things we are discovering every day. You have all the information, but again, you have to go through the history, because most of these patients, they have multiple issues. It may present as a neurological problem, but it could be something else like a chronic pain condition or psychological condition. So it can be quite interesting.
Welcome to the Consult by Australian Specialist Hub, where we discuss medicine meeting the law. Today we have neurologist Dr Janaka joining us today. Pleasure to have you on our podcast.
Hannah, thanks for having me.
Now we start off, would you like to tell me a little bit what drew you to medicine, and particularly the areas of neurology and neurophysiology?
Yeah, look, when I was in my early teens, I had an injury that required hospital admission for a prolonged period of time. And so during that period, I was inspired by the medical team, the doctors, nurses, allied health staff who worked quite hard, had full recovery. So I guess that was the inspiration behind me getting into medicine. And after graduating from med school, I had the opportunity of working with some really good neurologists and neurophysiologists who inspired me again, and they became my mentors. And that basically persuaded me to take up neurology and neurophysiology. Yeah.
Oh, fantastic. And we were just discussing what is the difference between neurology, neurophysiology, and then the third one, neuropsychology.
Neuropsychology, yeah. So basically, a neurologist is a specialist, who would look after brain and spinal cord problems and peripheral nerve problems. And a neurophysiologist is a neurologist who has subspecialized in neurophysiological studies, meaning the diagnosis of nerve and muscle disorders. So I'm a neurologist, but I have subspecialized in neurophysiology, meaning I do nerve conduction studies and EMG studies to diagnose nerve and muscle disease, muscle problems. So that's what a clinical neurophysiologist means.
Okay.
A person who has expertise in diagnosing nerve and muscle disorders. Neuropsychology is quite different. So neuropsychologists are psychologists, usually clinical neuropsychologists who have specialized in neuropsychological problems and assessment of patients with neurological and psychological problems. Yeah.
And are you generally seeing the neuropsychology reports included in your medico-legal work?
Yes. So in the medico-legal cases, we work with the neuropsychologists, mainly the clinical neuropsychologists, predominantly in assessing patients with head injuries or patients who have cognitive impairment, memory impairment. Could be related to a head injury, could be related to a neurodegenerative problem like dementia or Parkinson's. So the neuropsychologist would do a formal neuropsychological assessment, which is quite a long assessment. It takes about 4 to 6 hours, but it's a very good test which clarifies the severity of cognitive impairment or psychological impairment a patient would have with these conditions. So that would help a neurologist in assessing the patient and also in the impairment assessments.
Okay, very helpful.
Very helpful, yeah.
And we're just discussing that you've got a very, very busy schedule at the moment, teaching new neurologists and also assessing medico-legal assessments in 4 different locations.
Yes. So basically, I've been a neurologist, for around 15 years, and I got into the medico-legal space about 12 years ago. So I still do a lot of neurological work as a private neurologist, seeing a lot of private patients, and also I do some hospital work training the young neurologists and neurology trainees in neuroconduction studies and neurophysiological studies. Yeah.
Oh, fantastic. Do you have any particular unique cases or a really interesting case that you've seen recently?
Yeah. So with the medical legal assessments, there are some very interesting neurological conditions and medical conditions that we come across. So yeah, so there are a few cases. There was a medical legal assessment I did last year. Young female in her 30s who was referred for a concussion injury at work, and the concussion injury occurred about 6 months prior to that. But all the initial investigations were normal, but she continued to deteriorate, which was quite unusual. So the initial assessment was for a possible psychological condition or malingering, in addition to a neurological condition. So when I examined her on the day, I found some very abnormal neurological findings. These are called upper motor neuron signs, meaning there's a problem in the spinal cord or in the central nervous system. So it didn't quite match with the initial concussion injury. So I recommended further investigations, including MRI scans of the brain and spine, which showed that she actually had MS, multiple sclerosis. So it was very good for her. She received the appropriate treatment and had a very good recovery. And so sometimes we come across patients like that, who have been referred for a work-related incident or insurance protection claim or fitness for duty assessment, and we find something else with the assessment. So as a neurophysiologist, I see a lot of MNDs in my private practice as well, because MND is a diagnosis where you have to use your clinical skills plus the EFG studies. Okay, so I do the EFG studies and do the clinical assessment, and so there are a lot of patients with motor neuron disease. Yeah, we see. In the medical legal space, I've come across a few who've been referred for fitness for duty. Mainly, there's a patient in his 50s, manual worker, had no strength at all in arms and legs, gradually deteriorated, and he was referred for fitness for duty because all the investigations, the GP assessments, blood tests came back as normal. But when I saw him for the assessment, there were some troublesome features suggestive of MND.
Like dropping things all the time.
Yeah, so you can actually, these patients, they lose muscle strength, and you can actually see muscle atrophy, meaning the muscle wasting. And some of these patients, they have tongue wasting and weakness of the facial muscles.
Oh, wow.
Bulbar muscles, So he had a lot of features, and I recommended further EMG studies, because as an IME, I cannot do the investigations on the IME assessments, so we had to refer them elsewhere. Okay, and so I believe it was diagnosed as MND with the EMG studies, and so you get a few cases like that. In the medical legal scope, sometimes for income protections, life insurance claims. Yeah, there are patients with MNDs and similar neuromuscular problems.
Are you assessing TPDs as well?
Yes, I am selective of the assessments. If it's a specific neurological problem that I can help with, mainly neuromuscular, meaning neuromuscular disorders. Yeah, I do assess TPDs, because nowadays all the neurologists, we are subspecialized. There are MS specialists, epilepsy specialists, headache specialists. So depending on the referral, if I think that I can assist the patient appropriately, yes, I accept this. Yeah.
Wow. So even within neurologists, there's specific subspecialties.
Yes, absolutely. Because neurology has grown so much, over the last 10 to 15 years. Okay, so we all subspecialize, so and so I'm a neurophysiologist, meaning neuromuscular specialist. So patients with MS who go to a MS specialist. I mean, I do have patients with MS, like when we do the private clinics, we come across general neurology, MS patients, Parkinson's patients, every sort of, aspects of neurological problems. But, after the diagnosis, if they're complicated or if they require specialized neurological services, then I refer them on to see one of my colleagues. And they would do the same, if they come across a patient who's got specific neuromuscular diseases, they would refer the patients back to me.
Okay.
Yeah.
So any with MND would definitely be coming to you.
Yeah. So with the MND, you're probably aware of the Bethlehem Hospital Neuromuscular Clinic.
Yeah.
So we do the diagnosis and the initial investigations, but a clinic like Bethlehem Hospital, where they have specialized neuromuscular clinic with specialized physios, speech therapists, respiratory therapists, and neuromuscular specialists, that's the place to be followed up on after diagnosis. Yeah.
For our clients sending you medico-legal referrals, what would be sort of the top 3 or 4 conditions which would indication, okay, well, that needs to go to Dr. Janaka?
Yeah. So most of the assessments, they're patients with concussion injuries or head injuries. So it could be work-related, or I get a lot of referrals from TSE, road traffic accidents, concussion injuries. And number 2 would be headache and dizziness.
Do you get the sporting injuries as well? We're seeing sort of an increase in assessments of long-term concussions in sporting injuries.
Yeah. So and even in my private practice, I see a lot of concussion injuries and sports injuries because, like for example, footballers and rugby players, like sports injuries, they can injure their brachial plexus, which is the nerve trunk behind the shoulder. So I do specialized nerve conduction studies, for these patients to diagnose how bad the nerve injury is. And that adds some prognostic value as well. We can see how far the nerve has renovated. So, so I see in the private practice, but in the medical legal space, I have seen some sportsmen as well. Yeah.
And do you have any tips or tricks or suggestions for our referrers when sending a letter of instruction? We actually run a workshop called How to Write a Kick-Ass Letter of Instruction. So I'd love to hear your take on that.
Yeah. So, most of the letter of instructions, LOIs, I know they're adequate, but sometimes we don't get all the, the documents that we require. Okay. And some of the, the patients are actually quite good. They bring a big file usually, and they, not all of them, some of them. So in a situation like that, I ask the patients to show me the, investigations. But it's actually quite good if the referrers can send all the supporting documents, before the assessment, and also with clear instructions as to what they, would like me to assess and comment on.
Absolutely. I always say to our clients, don't assume, sometimes our experts are seeing multiple cases per day. One might be a workers' comp, there might be a medical negligence, next one's a traffic accident. So make those letters very, very clear.
Absolutely.
Tell us what you want. What are you looking for in these cases?
Absolutely. Yes. But most of the referrers, they are quite good. They've got some very experienced case managers and lawyers, they do the right thing.
We've got some great clients. Pretty lucky.
Yes, absolutely. Yes.
Would you have any wise words of wisdom for maybe another neurologist who's looking to enter into medico-legal and is sitting on the fence?
It is rewarding, and it is quite different to what you see as a private neurologist in your private practice. It will be the same conditions, but it's different in the sense most of the patients, by the time they see a neurologist for a medico-legal assessment, they would have seen about 10 or 15 other specialists. There's a lot of documents, different investigations. So the diagnosis is usually been made already. So it's different, to seeing a patient with a possible neurological condition in the outpatient. So you have all the information, but again, you have to go through the history, because most of these patients, they have multiple issues. It may present as a neurological problem, but it could be something else like a chronic pain condition or psychological condition. So it can be quite interesting, So yeah, if there are young neurologists, who like to explore medico-legal scope further, yeah, I would strongly recommend that. Yes.
Probably one of my favorite parts of the job is you just never know what's coming through the door. The diversity of cases is there's always something exciting and new happening.
Absolutely, absolutely. Yes, 100%. And as I said, like for the patients, it's quite rewarding as well. Most of the time, because sometimes the patients, they have to wait for a long time, to see a neurologist or have the appropriate investigations. Sometimes they get the medical legal experts seeing them, much earlier. And so the investigations and appropriate management, that gets fast-tracked as well, in the process.
Yeah. Which can be life-changing for that person, particularly if you're discovering they've got MS or MND, exactly, as you were saying before.
Absolutely. Yeah.
I actually had a consultant once, it was actually at the previous place we were speaking earlier, where someone was coming in for a workplace injury and he noticed a skin spot on her skin that was rather urgent, and sent her off to get that tested, and it was actually a quite advanced melanoma.
Right, okay.
Yeah. So, I think people also forget that IME doctors still have that duty of care.
Oh, yeah, absolutely. Yeah, look, so I've actually seen, few patients like that, even from, other specialists, my colleagues, they picked up other things. You would go for a psychiatric assessment, and there was one case the psychiatrist picked up actually a problem, orthopedic problem.
Oh, wow.
And so and was referred to see a orthopedic specialist and had some further investigation. So so as medical specialists, you're quite correct. We have a duty of care. If we find something not right, not sitting with the presentation or some red flags, you got to do the right thing. Yeah.
Absolutely. It has been a bit of a tradition for us to ask our experts some quickfire questions.
Oh, yeah.
So I might jump into the quickfire.
Right.
What did you want to be before medicine?
Okay, you got to laugh at this. I actually wanted to be a Formula One driver.
So still high performance. It's a high performance.
High performance.
McLaren, Mercedes, which team?
McLaren.
McLaren. Yeah. Can't go wrong with McLaren.
Yep. So it was only a dream,
Look out, Oscar Piastri.
That's right. It's one of my heroes,
Is there a
Piastri.
link between why the Formula One?
Oh, it's just that I know, just as a kid, you watch all these, shows and videos, had a passion for that. Yeah. So, but, didn't work out.
Still high performance. There's a theme.
Right. That's right.
What is something about the brain or nervous system that still amazes you?
Oh, okay. There is a lot of things about neurology and brain we still haven't been able to figure out. So we still haven't quite cracked the code yet. Yeah, there's still new things we are discovering every day.
Wow.
Yeah.
What is something about neurophysiology that surprises people when you explain what you do?
Right, yeah. So when I do a nerve study or an EMG study is a small needle that we insert into the patient's muscle to look at the muscle activity. So I tell the patients usually, look, I'm going to listen to your nerves and muscles, and most of them, they just get puzzled, doc, what do you mean by, you listen to the muscles,
Hey, what does that sound like?
Yeah. So I actually show them, on my monitor, you put a needle in the muscles and it actually makes a sound. So the sound is when the brain sends a signal to the muscles, it's all electrical discharges. We pick it up on the monitor, and from the sound and from the way the wave patterns behave, we can say whether the muscle is damaged or not, So, yeah.
That's incredible.
Intriguing stuff, yeah.
Listen to nerves. I did not know that.
Yes, into the nerves and the muscles, yes.
Actually, and I've heard nerve conduction studies many times, but I actually have no idea how that's actually done.
Oh, right, okay. Yeah, so it's actually, so we test specific nerves, and so there are small electrodes we put along the nerve pathways, and there's a small electric stimulation that we give along the nerves. And it's not painful, but it can be a bit uncomfortable sometimes. So we start at a low intensity, and Yeah, you should come and check it out sometime. The
Yeah.
connection studies.
That
Yeah.
would be cool.
Yeah.
We could do our next episode of the podcast.
Yeah, absolutely.
So
Visit you.
I always wondered, so for example, like thoracic outlet syndrome is one, you
Yeah.
see a lot of the nerve conduction studies figuring out whether that's functional or structural, and then
Yeah.
sort of, what does that look like? But I guess we can do that another episode. It'd be really
Yeah,
cool.
thoracic outlet syndrome is a bit it's a bit of a complicated thing, So again, with thoracic outlet, there are two components: the neurogenic thoracic outlet and the vascular thoracic outlet. Meaning, so where the thoracic outlet is, it's a nerve and blood vessel bundle that goes through the apex of the thorax here, and so if the nerves get compromised, then you can get neurogenic thoracic outlet syndrome. But sometimes the nerves could be fine, but the blood vessels can get compromised. So especially when the patients lift their arms, the blood flow can get blocked. They can get symptoms. Okay, so the nerve conduction studies are not conclusive, sometimes. Okay, so we have to do Doppler ultrasounds of the blood vessels.
Oh, wow.
The arm hanging out and arm up, see if there's any blockage. So it's a clinical diagnosis, plus you have to look at the investigations, because it's a hard diagnosis to make, and you have to be sure of the diagnosis, because shouldn't have surgery, for if it's not thoracic outlet syndrome. So yeah, it's a bit of a complicated diagnosis.
And I've seen it's one of the most complicated ones to do an impairment assessment on too. I've seen.
Yes.
Yeah.
Absolutely. So using the guides, the AMA guides, let's say, you have just vascular thoracic outlet syndrome without a neurogenic component. Using the guides, the neurological chapters, you can't do impairment, Yeah. So that's some of the drawbacks in some of these guides, but it's not 100%, the impairment assessment, So I agree with you. It's the impairment assessment in thoracic outlet syndrome. Yeah, is very, very tricky. Very tricky. Yeah.
You need someone like Dr. Janaka. There's a lot of experience in that area.
It's so in a thoracic outlet syndrome, we need to get a vascular surgeon as well to give an opinion regarding the vascular component, and a neurologist. And also there are other things that can mimic thoracic outlet syndrome. The patient could have cervical radiculopathy, a disc due to pressure, or it could be a different nerve injury like a brachial plexus injury. So you have to make sure that all the other investigations have been performed and everything else is excluded before we come up with the diagnosis of thoracic outlet syndrome.
You have to be so thorough.
Yes, absolutely. Yeah.
How does a neurologist switch off?
Golf.
That's a great answer. Well, thank you, Dr. Janaka, for coming on the Consult by Australian Specialist Hub. It's been a pleasure having you here, and we covered some great topics.
Yep. Thanks for igniting me, Hannah. Yeah. Pleasure working with you.
Thank you.